Okay, so first I just want to make sure that we're all on the same page in terms of order versus administer. Obviously, I'm sure we are, but just to be on the safe side. So order is prescribing for a test. So making sure that the person who is saying that the patient needs the test is authorized to do so, and then administer is actually conducting the test on the patient. And that can be a very important distinction when we're talking about payment for the test. If the test has not been properly ordered, then the administration of the test may not be reimbursed by insurance. So we always need to be sure that we're authorized to order the test and administer the test, or whatever we're doing at that time. So again, Health and Human Services, let's start with COVID. Health and Human Services guidance allows pharmacists to order and administer the COVID-19 tests. So already most pharmacies that have received CLIA waivers are allowed to administer these tests, and they have been doing so, which is phenomenal. I know personally I got mine at a pharmacy, so it's a great place to get that done, because they already have the drive-through and everything ready to go. And that guidance was issued back in April, so they've been doing that for quite some time. So obviously this also expands to ordering the tests as well. Some states are very clear about who can and can't order the test. Not all states are. So this guidance says, yes, pharmacists can order the test. And so it removes that need for a physician to have to order the test. So again, the patient can just go to one place and get that taken care of. However, it's important to note that this guidance from Health and Human Services specifically did not clarify payment for the testing. So even though the pharmacist can order the test, it didn't give provider status necessarily to pharmacists. And I know that's an ongoing concern, but it was not addressed here. And we are definitely keeping our eyes out for any changes to pharmacists' provider status, because that's a huge issue across the country. So we also
have somebody ask, sorry to interrupt you, but we have somebody asking, can you elaborate on pharmacists' ability to order the COVID-19 test without a physician prescription?
Yeah, so a patient can get, if they are presenting symptoms or if they've been exposed to COVID-19, they can present themselves at the pharmacy, and the pharmacist has been authorized by Health and Human Services. There's the department has clarified that the pharmacist has the authority to order the test. They can also administer the test. So they can actually kind of prescribe that the test be done, and then they can conduct the test themselves.
Okay, thank you.
No problem. So we've also seen in states where maybe ordering tests or even administering tests was not specifically allowed in statute or regulation, that governors and their departments have stepped in and filled that gap. So in Kentucky, pharmacists weren't authorized to order the tests. And so in April, the governor of Kentucky, Governor Beshear, went ahead and issued an executive order allowing pharmacists to order and prescribe the tests. Same in California. The Department of Consumer Services back in May had to issue a waiver to pharmacists, allowing them to order and administer the tests because state law was really unclear about that. So that solved that problem for us so that they could do it without consequence.